Welcome to TelehealthFX Talk. This is our season finale, and we saved one of the most searched and most feared topics for last: Ozempic face and loose skin. If you're on a GLP-1 medication or thinking about starting one, these are the aesthetic concerns that keep people up at night. Will I look gaunt? Will my skin sag? Will I trade being overweight for looking old? Today, we're going to explain exactly what causes these changes, separate the myths from the science, give you a specific 7-strategy prevention framework, and walk through the treatment options available if they do occur. This has been an incredible season, and we want to wrap it up by giving you the information that helps you feel as good as you look. If you want a clinical team that addresses the aesthetic side of weight loss, not just the medical side, visit TelehealthFX.com. That's TelehealthFX.com.
All right, let's start by clearing up the biggest misconception. Ozempic face is not a side effect of the medication. It is not something the drug does to your face. It is a consequence of rapid, significant weight loss, and it happens regardless of how the weight is lost, whether it's from GLP-1 medication, bariatric surgery, extreme dieting, or illness. If you lose a significant amount of weight quickly, your face can change. The term Ozempic face stuck because GLP-1 medications are the most widely used weight loss tool right now, but the phenomenon itself is as old as weight loss.
So what actually happens? Your face contains fat pads. These are deposits of fat that give your face volume, contour, and a youthful appearance. Your cheeks, your temples, the area around your eyes, your jawline, all of these areas have fat pads that contribute to how your face looks. When you lose significant weight, these fat pads shrink. Your face loses volume. The result is that hollowed-out, deflated, gaunt look that people associate with Ozempic face.
On top of the fat pad loss, your skin may not be able to keep up. Skin needs time to retract and adapt to a smaller volume underneath it. If the weight loss is faster than the skin's ability to adjust, you get sagging. And if you're over 40, this is compounded by the fact that your body is already producing less collagen and elastin, the proteins that give skin its firmness and snapback ability. And a 2025 study from Vanderbilt University actually documented and quantified this, showing measurable decreases in midfacial volume in patients who had significant GLP-1 weight loss.
There's also a muscle component. As we've discussed extensively in this podcast, some GLP-1 weight loss includes lean muscle mass, not just fat. When you lose facial muscle along with facial fat, the volume loss is even more noticeable. This is why muscle preservation, which we've talked about in episodes 2, 8, 17, and 19, isn't just about your metabolism, it's also about your appearance.
Now let's talk about loose skin on the body, because the same principles apply on a larger scale. When you gain weight, your skin stretches to accommodate the increased volume. The collagen and elastin fibers in your skin get stretched and sometimes damaged over time. Then when you lose that weight, the skin may not be able to retract fully, especially if the weight loss is rapid, the total amount lost is large, you're older, you have genetic factors working against you, or you've had lifestyle habits like smoking or heavy sun exposure that have damaged your collagen.
So the question everyone wants answered is, can you prevent it? The answer is, you can significantly reduce the risk and severity. You may not be able to completely eliminate it, especially with very large amounts of weight loss, but you can give your skin the best possible chance to adapt. Here's our 7-strategy prevention framework. Strategy 1. Moderate your weight loss pace. Slower, steadier weight loss gives your skin more time to adapt. The good news is that GLP-1 medications already produce more gradual weight loss compared to something like bariatric surgery. Aim for about 1 to 2 pounds per week, which is in line with what most GLP-1 patients experience after the initial rapid phase. Strategy 2. Maximize your protein intake. Protein is essential for collagen repair and muscle preservation. Target 0.7 to 1.0 grams per pound of body weight per day. Some people also add collagen peptide supplements, which provide the specific amino acids used in collagen production. The evidence on collagen supplements is still developing, but many dermatologists consider them a reasonable addition.
Strategy 3. Resistance training. Building muscle beneath the skin provides structural support that fills in the volume where fat used to be. This directly improves skin appearance and firmness. We've covered this throughout the season, and it remains the single most impactful intervention for both metabolic health and aesthetics.
Strategy 4. Stay hydrated. Dehydrated skin loses elasticity faster. Minimum 64 ounces of water per day, more with exercise. This is simple, but many people on GLP-1 medications who are eating less and may experience GI side effects don't drink enough water.
Strategy 5. Nutritional support. Vitamin C is essential for collagen synthesis. Omega-3 fatty acids support the skin barrier. Zinc supports skin repair. Antioxidants protect existing collagen from breakdown. Eating a nutrient-dense diet rich in these elements gives your skin the raw materials it needs.
Strategy 6. Sun protection. This is the single most impactful anti-aging skin intervention that exists. UV radiation breaks down collagen and elastin. Wearing sunscreen SPF 30 or higher every single day, even when you're not at the beach, protects the collagen you have. This is non-negotiable.
And strategy 7. Avoid smoking. Smoking directly accelerates the degradation of collagen and elastin. If you smoke and you're losing weight, your skin laxity will be significantly worse than it needs to be.
Now, if loose skin or facial volume loss does occur despite your best efforts, there are treatment options. On the non-surgical side, dermal fillers can restore volume in the face, particularly in the cheeks, temples, and under-eye area. Biostimulatory treatments like Sculptra stimulate your body's own collagen production. Radiofrequency and ultrasound-based skin tightening can help remodel collagen for tighter skin, and microneedling with radiofrequency can improve both skin tightness and texture.
For more significant loose skin, surgical options exist. Abdominoplasty, commonly called a tummy tuck, addresses excess abdominal skin. Body lifts can address multiple areas simultaneously. Arm lifts and thigh lifts target specific problem areas, and face and neck lifts address significant facial changes. If you're considering surgery, the general guidance is to wait until your weight has been stable within 5 to 10 pounds for at least 3 to 6 months. And you'll need to discuss pausing your GLP-1 medication before surgery, because these drugs slow gastric emptying, which can affect anesthesia safety.
And here's what ties this all back to TelehealthFX. Everything we've discussed throughout this entire 20-episode season comes together in this conversation about skin. GLP-1 for gradual, sustainable weight loss, resistance training for muscle preservation that fills in volume, sermorelin for lean mass support, NAD+ for cellular repair infrastructure, protein optimization during onboarding. This comprehensive approach inherently gives your skin the best chance to adapt because it addresses every factor contributing to loose skin and facial volume loss. That's not a coincidence. That's the difference between a prescription-only platform and a comprehensive clinical program. TelehealthFX offers semaglutide, tirzepatide, sermorelin, NAD+ therapy, and berberine, all under the guidance of licensed clinicians who look at the complete picture, including the aesthetic outcomes you care about. 24-hour provider review, one-on-one onboarding, transparent pricing with no hidden membership fees, 2-day UPS shipping, licensed in all 50 states. Visit TelehealthFX.com. That's TelehealthFX.com. That wraps up Season 1 of TelehealthFX Talk. Over 20 episodes, we've covered the FDA compounding ban, muscle preservation, tirzepatide versus semaglutide, GLP-1 and alcohol, men's health, women's health, seniors, mental health, NAD+, sermorelin, berberine, plateaus, and now skin. Our goal from day one was to give you research-backed, honest, clinical education that helps you make informed decisions. We hope we've done that.
If you're ready to start or optimize your GLP-1 journey with the most comprehensive clinical platform available, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz, connect with a provider who sees the whole picture. Build your plan. That's TelehealthFX.com.
And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. Cosmetic concerns should be discussed with a board-certified dermatologist or plastic surgeon. Individual results vary.
Thank you for listening to every episode this season. Share the show with someone who needs it. Leave a review if it helped you. And stay tuned for Season 2.
We'll see you next time on TelehealthFX Talk.